Okay, so a really common injury is actually thumb strains. As you can see, the thumb is not a particularly protected joint. It sticks out on the side there, and it's very easy to dislocate your thumb, pull your thumb, and you can easily strain the tendons that attach to the thumb. So one of the things that I often address for grapplers, actually more than anyone else, is how they can actually treat their thumb once they've strained it, pulled it, dislocated it, anything like that. Just even just stoving your thumb. So one of the things I always recommend that you have is a very small ace bandage. This is not the standard 3 inch; it's like a 1.5 inch. So we'll use one of those. But we'll start off with just some manual therapy on our thumb. So first thing you can do is take your other hand and you can find this tendon here. You'll feel it actually pop underneath your thumb as you press down on that tendon. As you push on that tendon, you kind of want to work it back and forth across it. And what that'll do is it kind of gets that tendon moving freely if it might have any kind of adhesion to the muscle or to the bone. We'll do this even with Achilles tendon sometimes. I'll take runners and I'll take a look at the back of their foot. If their tendon is not moving properly and it doesn't move freely in there, there's usually some scar tissue, maybe some issues in there that are unresolved from past injuries. But you can kind of see this tendon. I'm trying to exaggerate it by kind of like flexing my hand a little bit here, but you can kind of see that tendon underneath there. And as I work my finger across it now, that tendon's going to snap back and forth underneath there. It's like a rubber band pulled real tight. So anyways, that actually feels pretty good to break that up as you push on that. You might notice that that is enough to relieve some of your pain. But then you can also do things like a nerve glide. So what you do is you're going to put pressure on that, and then you're going to start curling your thumb down as you slide your other finger down the side here. So the way this would work basically is you're going to manually stretch that tendon by pulling it down with this part, and then you're going to actively stretch that tendon by pulling your thumb down and inward. So I'm just trying to get a good camera angle where you can see both sides of it here. But I'm going to put pressure on this tendon and slide down on it while simultaneously actively bringing the thumb forward so that it creates as much tension on that tendon as possible. So what's happening here is I'm extending it to its full range of motion as I'm putting pressure on it. This technique is very similar to something called rolfing or structural integration. A lot of therapists will use this for muscles. I found it to be effective for using it on tendons, especially in the hand or the foot. It seems to be that a lot of times these tendons here, because they're superficial at the surface, they're easily damaged, contused, so you'll have some bruising, a little bit of bleeding internally, which kind of causes some adhesions in those tissues. So there's actually a sheath that wraps around your tendons. If you can break that sheath up, the tendons slide much better. And you may find a little bit of movement in your thumb as well as you work this way down. A little bit of lateral movement and things like that can also help to relieve the pain in there. Once you start breaking that up, the next thing you want to look at is the wrist. So we'll take it all the way down to the base of where the thumb attaches to your wrist here with that tendon, and we're going to try to turn our wrist away from us as we drive down through that wrist region there. You're just basically tracing the tendon as you actively pull your range of motion all the way to the far end of as far as that tendon will stretch, as far as your flexibility will allow you to go, and you're just actively riding down that tendon to try to break up any kind of just basically garbage. If we would just want to keep it in like layman's terms, there's just some junk that gets in there from damaged tissue, whether it's scar tissue, cytokines, things like that that have just built up in that area due to the inflammation. You just want to get all that out of there. Now, the next trick I have for you, you may have seen videos of Kelly Starrett talking about things like voodoo floss. He'll use it on different joints. The thumb is a really hard one to do it on. If you've ever seen the voodoo floss, it's like a nice 3-inch wide piece of latex, and you got to wrap it around, and you want to have some range over it. Doing it on your thumb is practically impossible. So My solution to it is to use an ace bandage, and I anchor it to my wrist first. So you want to make sure it stays on tight on the wrist. So what I'll do is I wrap it a lot like how you might start the wrap for maybe a boxer, but here's the catch. This has to be extremely tight, like so tight you would not want it to be this tight for any length of time. So I'm literally pulling all the slack out of this I possibly can. I'm going to wrap up and around the thumb here. I'm going to come back down, creating like a V shape almost, and I'm going to head back down around the wrist again. I'm going to come back up exactly the same way I came the first time, trying to get all the slack out of this thing I possibly can. I'm really pulling this tight. Coming back up and around that thumb again. This time we're going to make a loop around the actual thumb. So again, the most important part is getting all that slack out of there. We're going to make a loop around the thumb. You can make one or two. Make sure you got that around there. You can probably see the line now that I'm wrapped around the thumb. Take it back down around the wrist again. It doesn't have to be pretty. It just has to be tight. It has to be as tight as you can possibly get it. So we'll wrap the wrist a little extra. That way the wrist is locked in real nice and tight for whenever we're moving this movement. Again, I can't emphasize enough how important it is to get all that slack out of there. Wrap it around the wrist, bring it up around the thumb again, locking that thumb joint off, pulling it back down around the side. You're going to have this nice V shape there. Coming back down around this way, really getting all the slack out, really pulling this thing tight. When you finish this, it should feel like you just locked your hand in place so that you could not move your thumb at all. So the idea behind it is that we're basically creating like a braced support here. Now, I'm not going to bother trying to pin this thing because trying to put a safety pin in it with one hand is probably the best way for me to puncture a vein. So, once we've got this here, I'm just going to keep tension on it with this hand. Now, what I want to start off with is just some wrist movement, breaking that up a little bit. You can come forward and back as well, side to side, get that wrist kind of moving around a little bit, do some circles. And then, as much as you can, work the thumb back and forth. So we're just taking that thumb and just in and out as much as we can. It's going to feel really tight. It's going to feel extremely difficult. You have a lot of resistance. You're going to feel all that tension around it, pulling on it. It may even be a little bit painful. You're going to actually feel some pull in that tendon because there's so much pressure on it. If you pulled this tight enough, there should not be any slack left in this. You can kind of work that back and forth. Now, what else you can do is if you're coordinated enough, which I am not, you can keep a hand on this and you can actually manually work this one a little extra distance by taking your opposite hand and just kind of pushing him to his end range. So you want to control it as far as you can and then give it a little extra push. As far as you can, a little bit extra push. You can work them out, see how you can move it around, see if you can move it back and forth, as well as in and out laterally a little bit. You probably won't have much lateral movement. The lateral movement should be pretty limited because if you wrap it tight enough, there's not going to be a whole lot of movement in there. But that's not what we're really focused on. We're more focused on this internal, and we're going to take this, work the wrist around a little bit more to wrap things up. Maybe even you could kind of take a approach where you're moving your wrist and your thumb are all the way in this direction. You're going to curl the thumb in as you force your wrist in the opposite direction, and then you're just going to take this off, which is going to be a fantastic relief because if you tied it tight enough, you're probably starting to feel like your blood circulation is completely gone. And just like that, suddenly any tendonitis that you have in your thumb, any issues like that, are going to be drastically reduced. It may take more than a couple exposures to this. You may have to do it multiple times. You may have to do this daily even to break that up, depending on the degree of tendonitis that you have in there. I've often done it for fingers and wrists and stuff like that when I'm doing a lot of bag work. So that's basically how we want to break this up, though, and a lot of that, working across that tendon as much as you can to try to keep things mobile and broken up in there. That'll really keep things healthy, keep the blood flowing. You can even try putting a little bit of heat on it before you do this, and that'll kind of get some blood flow through there, kind of get things moving nicely before you even get started. So good luck to you, and I wish you all the best. Hope that your thumb feels much better.